What is a STEMI, S-T-E-M-I?
So a STEMI is a full-blown heart attack. And on the electrocardiogram, that is ST elevation myocardial infarction.
So ST segment elevation during those are big medical words, but let's look. Let's look at this electrocardiogram right here and tell me, is that normal or abnormal?
That is a nice normal PQRST, nice normal electrocardiogram.
Okay, so tell me what the P and the QRS and the T mean.
So the upper chambers of the heart, the atria, the P wave, as it depolarizes or changes, that's when the upper chambers are contracting.
So that's electrical activity, I think, that you're seeing right there. And as it depolarizes, it's that electrical charge. You get that little blip. The first one is a P.
That's right. And then the spike is a QRS complex, and that has a lot more voltage. It's a big spike because the ventricles that have the heart muscle, that's when the heart muscle is contracting.
That's the big pump that's right there.
Yes.
That's where sometimes the heart attack occurs.
That's right.
Okay, and then what's the T wave?
So that's when the heart relaxes between heartbeats. So we call it diastole.
Okay, now let's look down at the bottom, and this is very important, with the ST segment.
Yes.
Now, all those are on an even line. Let's show electrocardiogram number 2. And then we're going to go back to number 1 again. Let's go back to number 1. Okay, so let's talk about the ST segment.
Yes, so that ST segment is flat. It's at baseline, what we call isoelectric.
And so that's where you want it to be, normal electrocardiogram.
Yes.
So STEMI, ST segment elevation with myocardial infarction, with heart attack.
That's
so
right.
Let's go to show me the STEMI.
Yes.
Now, what do you see there?
Oh, that's a very typical appearance of an acute heart attack, a heart attack that has just happened. It could be within a few minutes even, and it would show ST elevation.
So you can see the P wave.
You see the P wave.
You see a QRS.
Yes.
And then the ST segment is elevated way high.
Correct.
Dangerous sign.
Correct. And the T wave is very peaked. So that's a very characteristic appearance with a heart attack.
So if you see that on an electrocardiogram, what do you know? They're having a heart attack.
So we, all hands on deck, we call it a code STEMI. So we activate all the resources. For example, that tracing may be taken from an ambulance. The paramedics in the field, they can come to someone's house and they can see that and they can transmit to us in the hospital, and we know ahead of time that this is a STEMI, this is a heart attack.